Dear students, now we will discuss about local anesthetics. First of all, let we know what is local anesthetic. Local anesthetics are the agents used to abolish pain sensation locally without losing consciousness. That means they are used to abolish. Abolish means stop. What they want to stop? Pain sensation locally in a particular area, locally without losing consciousness. There should not be loss of consciousness, awareness. Person should be aware what is happening to his body, particular area it may happen. So we understood local anesthetics are used locally to a particular region. For example, to do local surgery in the hand, they will inject here, they will lose the pain sensation, but they will aware what is happening here, pain sensation of hand. Like this, local anesthetics are the agent which used to abolish pain sensation locally without losing consciousness. So this is the definition of local anesthetics. For a particular local anesthetic, there are some characteristics. They should have some characteristics to become a ideal, a good local anesthetics. These properties are: local anesthetic should be non-toxic. Number one, it should be non-toxic. It should not produce toxicity in the body. It should non-irritant. It should not produce any irritation in the local area. It should produce vasoconstriction. It should constrict the blood vessels to prevent excess blood flow. It should produce reversible action. Local anesthetic should produce reversible loss of sensation. After some time, again it should pain sensation should come, and it should have rapid onset of action and sufficient duration of action. It should have rapid onset of action, means it should produce the action very fast, and the action should be the particular sufficient time. That is, these are the 5 properties of local anesthetics. Now we will go for a classification of local anesthetics. There are mainly 2 types of local anesthetics are there. Some are esters and some are amides. The examples of esters type local anesthetics are procaine, cocaine, tetracaine, butacaine, benzocaine, etc. These are the ester type of local anesthetic. And amides type ididocaine, lignocaine, mebubacaine, bupivacaine, etc. These are amides type of local anesthetics. This is the classification of local anesthetics. Now we will study the mechanism of action. How local anesthetic produce the action. The site of action of local anesthetic is cell membrane, in the sensory cell membrane, where we are using the local anesthetic locally. And how it produce the action. For example, this is a cell membrane, particular area of area in our body. When local anesthetic is given, that local anesthetic is absorbed and they will enter inside the cell. And inside the cell, what happen? It block the sodium ion channel. So let we know what is the role of sodium ion in our body. When sodium ion enter inside the cell, influx of sodium ion will enter, then in the cell action potential, depolarization, current will generate, which carries the sensation. So whatever we are feeling the sensation, these sensations are due to the action potential, current generated in the locally, and that will travel through the nerve endings. So local anesthetic will, what they will do, they will block this channel, sodium ion channel. They will bind, they will block, either directly block the channel, or they will bind particular region in the channel and change this configuration. this ion channel, sodium ion channel, this is the channel. For example, sodium ion will enter like this, but they will change the configuration like this. If change the configuration, so sodium cannot enter. So either they directly block here or they change the configuration. For example, they change this way. Now sodium ion cannot enter. Sodium ion cannot enter. So either they change the configuration of the ion channel or they block the ion channel. By this way, they prevent the entry of the sodium in the nerve ending. And this is the mechanism of local anesthetic. There are some adverse reactions of local anesthetic. The most commonly seen adverse reactions are CNS, central nervous system related, like vomiting, nausea, convulsion, respiratory depression. This type of side effects are observed if local anesthetic enters systemically. They enter inside our body. If the locally you have given a local anesthetic and that local anesthetic absorb from that local side and enter to our blood circulation, then only these side effects are seen. The main common side effects in central nervous system are vomiting, nausea, convulsion and respiratory depression. Like CVS, cardiovascular system, they will produce bradycardia, they decrease the heart rate and they produce hypotension, decrease the blood pressure. And in the locally, where these local anesthetics are given, in that particular area, it may produce edema. Edema means fluid retention. Okay, swelling will be there. Pain, it after some time, you may feel the pain sensation, skin discoloration. Like this, some local problems one can observe, one can find. If now local anesthetics are given overdose or extra to the body, and then how to give the treatment? In case of local anesthetic given as an overdose, there is an antidote is given for that, and in generally given short acting barbiturate. Short acting barbiturates are called antidote of local anesthetics, mainly pentobarbital, secobarbitons. So this is brief about local anesthetic.